This is Innovation Connected, coming to you from the World Economic Forum in Davos, a podcast by Tenity.
My name is Max Planck. I'm a venture partner for Tenity, and I would like to welcome my esteemed guest from New York. Welcome, Mark.
Thank you. Great to be here.
Thank you for coming here to the late hour in our tiny studio here at the WEF. Maybe you can give us a quick background about yourself and also maybe about your career, because it's quite interesting.
Sure, yes. So I grew up in the UK and I trained as a pharmacist originally, practiced for a few years, decided I wanted to do something a little bit different for a while and come back to pharmacy. And it's a little bit by accident, but became a copywriter in an advertising agency, which I loved, by the way. It was great. I never, ever imagined as a kid at high school, that I would get paid to write. So that was a real pleasure. I did that for a few years, and then along with another partner, set up our own agency and consulting service that focused in healthcare, which was at one side consumer health, on the other side prescription medicines, a little unusual at the time. And we built a very successful company, and we sold it to one of the large multinational groups, and eventually the deal was finished, the earn-out was done, and I was going to leave, and they invited me to stay with them, but to go to New York, where they were setting up their headquarters. So that was the move to the States, and there I helped build a global business, really to serve large pharmaceutical companies, large medical device companies for their sort of global marketing needs. Before that, launching a global brand was very unusual, and they were just moving into this phase of becoming more globalized. So my job was to build that network and acquire missing gaps in our services from different countries around the world. So everywhere from China, Japan, Europe, US.
And what are you doing now?
Now I am an investor in venture capital fund. We're a venture growth fund based out of New York, 5 partners, and we focus on health tech, med tech, and biotech services.
Okay. Is commercialization then probably a big thing where you look at?
It is. One of the key focus areas for us in the fund is we're a little bit unusual in that we're a 10-year fund, but our aim is to be a 7-year fund.
Yeah.
So we're looking for companies that can really accelerate growth fast so that they can get to the kind of returns that we're looking for in our investments within a 7-year period.
Yeah.
So that we can return capital earlier, or at least have the ability to give our investors the option that we return the capital to them earlier. And that means we're looking for companies that have particularly good commercial strategy.
Yes. Or do you support them if they have not so good strategies?
We do. I mean, it's an important part. We hope, a lot of value to the companies. Yeah. We, over our years of our partners' networks, have built up a lot of relationships in distribution, for example. And we try to open doors for those companies to help them get growth faster.
Yeah. But in the end, it's then an exit to a big pharmaceutical targeted within 7 years, or are there other possibilities for you as a fund?
Definitely, and I think we go into an investment with either a deal already pretty much tied up for the exit, or a very clear picture of what that deal will be, and it can't be a very limited number of options. We look to have companies that have multiple exit opportunities, whether it's through private equity, public offering, or to a strategic like a big medical device or other organization.
So more mature companies, bigger companies.
Yeah.
Okay. What's an average, let's say, valuation? Is there something which is very, I don't know, a billion plus or below?
It just depends on the investment. Some are higher risk, higher return, and others are lower risk. Like everybody builds out their portfolio in that way. So, but yes, 500 million, a billion, 3 billion. So, yeah.
Okay. With that experience you have, would you say that this is a big problem in the market? That, let's say, the commercialization is often not that good when the founders are scientists, maybe have a different background and view on the market.
I think there's all different sorts, and of course you're always trying to find people who are much more commercially aware. But you're right, in this particular space, a lot of founders come from much more academic backgrounds who are less familiar with the commercial world, so it may not be top of their list. And we try to support those people, and but I think a big part of investment selection is really about the people.
Yeah.
Do they have the grit to get there? Do they have the gravitas to lead a team and to build a team? To understand that they need the right types of people around them. So those people come to the surface very quickly when you start looking across companies. And that's what we look for. And of course, we support in every way.
Okay. What would you say is the biggest challenges currently in the industry, in the VC industry for healthcare?
Well, finding really good quality opportunities to invest in. There are lots of opportunities, but finding really good ones that fit our particular strategy, it's not easy, it's hard.
Yeah.
Everybody will tell you that. And we probably see 14, 15, 1,600 opportunities in a year, and we invest in about 3.
With 5 partners?
Yep. Yep.
Then how do you do that? What is the process from the 1,500 to 3? It must be a computer-driven approach.
It's semi-automated for sure.
Yeah.
But I think some things with a quick look can give you a real sense. If we do the initial look, our process is that one of the partners will do a maybe it's 2, but not necessarily the full team will do a full meeting, get a much deeper sense, and if they get excited and interested, then they bring in the rest of the team. And then the process is we have an investment committee, and after a lot of due diligence and the full list of those types of things that go on, we'll put it to the investment committee as a formal investment opportunity, and we have to have complete consensus from our partners.
Yeah.
And what's interesting about the team is we come from different backgrounds, so we're very complementary skills, and each of the partners looks at the opportunity through a slightly different lens, but all with the same end goal. But that's great because they'll be looking for things that some of the other partners might not see.
Yeah.
And the thing about investing, you kind of have to go in with the attitude of why not to invest. Why should I not invest in this company? And if you can't find any reasons not to invest, then maybe you do.
Well, you should, yeah.
Yeah.
Do you see now, from the geography wise, do you see different areas which are coming more interesting companies out? Or is it just globally and you have one there, one there?
No, I mean, we're looking pretty globally. We've got a very good network. Of course, like all companies in our investors in our space, people will find us and reach out to us as well. Yeah. But vast majority come from our own network of people that we know, mostly because they also, I think, know us and know what we're looking for a little bit more. But yeah, we've got people we know in every corner of the world, and we've got investments right now, one out of Singapore, one from Israel, several in Europe, and the rest in the US. So it's a pretty global portfolio.
I mean, it's also, a lot of governments invest a lot into research centers, into universities to, let's say, develop more talent, generate more patents. And it seems that there's a bit of a competition strongly going on now. And do you see already results from these investments from the different areas?
Yeah, I think that's now really become very sophisticated. The number of accelerators, government funds, government schemes, local schemes, university schemes, has meant that there is a robust startup market. And I think that's now getting to the stage where many of those startups are looking for Series A. So they've got funded through grants, or maybe it's local money from local region or national government or universities, or even local angel money. But then they go to the market to look for, I guess, more serious investors who are going to support them on their journey. And that's often, we find, the point at where people haven't thought very deeply about commercial strategy, or perhaps in the way that we would expect them to have done at that stage. And the big difference we see there is between the US and really the rest of the world. The US earlier stage companies are much more sophisticated in their commercial thinking. It's kind of built in most cases, not every case, but in most cases. Whereas when we look in Europe and rest of the world, firstly, it's usually just not as sophisticated, full stop. They'll give you a very large number for a large market and say, we're going to get some of that. I'm exaggerating a little bit, but
it's a classy one.
But no, I think the other big piece is really that they're often coming at it from, and makes sense, from a perspective of their local market. It's hard to understand the complexities of the US market if you're coming from Europe and haven't had any experience there. And I mention that specifically because if you're not building your life science company to succeed in the US market, then you're likely not going to attract the type of investment, because that's such a huge amount of value that you've left sitting on the table. So you really have to be thinking about that from the get-go.
Did the commercialization change over the last 10 years by regulation, by market demand, by insurances?
Yeah, so I would say 10 years ago, first of all, innovation was, wasn't so much innovation around, and the innovation that was coming out was quite dramatic in some cases. As the years have gone by, there is much more. These startups, these incubators have been working hard. There's a lot of innovation, but a lot of it is a small amount of innovation, 20% better, 25% better. And that, combined with the fact that I believe it's probably never been more difficult to commercialize anything new. Markets are very busy. People have become very sophisticated about how they choose and select products, whether it's a B2B or a consumer. It's easy to find low-cost marketing channels, which are now crowded and full of other people with other sophisticated messages. So you've got to break through and think, how do you reach your consumer? So busy, competitive markets, not necessarily directly competitive, but just buying for share of voice in any marketing campaign can be really difficult today and cost more money. So I think that combination, together with there's much more, people are used to innovation now. They're used to seeing new stuff. And so they plan for it a little bit better. And therefore, it's hard. It's much harder now, I think, to commercialize. The old established companies still hold onto and very tightly controlled distribution in many markets, which makes it very hard to break into. Unless you partner with one of them, and that may restrict your growth, it may accelerate it. It depends on how you've approached the market.
What do you think about corporate VC in that space?
Well, I think they're like any other VC. There's really two types, though. Many corporations have a VC group but they are a standalone P&L. They live or die by what they create, so they're not necessarily buying or building for corporate strategy. So they're just like any other VC, basically, but they're funded as another revenue stream by that corporation. The other type is a more strategic group, which might be specifically looking for strategic opportunities for that particular company.
Is that less than 10 years ago? Just strategic investors?
No, I think that's more companies are doing that. More companies are also realizing that, I mean, many of these companies have grown so massively now, and that brands and sectors have grown, that particularly in the life science space, for example, pharma biotech, the size of some of these brands are enormous, and their lifespan is as long as the patent life in many cases.
Yes.
And so you're now trying to plan for patent expiry for mass, $25 billion. How do you plan for that? So your own internal R&D can't keep up with that.
Yeah.
So you have to be looking out into the market to be able to feed growth.
Yeah. So you already know what they need in 7 years and can target that already.
That's right.
Part of your investment decision.
That's right. That's right.
Okay. What are the hottest topics in healthcare at the moment?
Well, I think we're focused on three verticals: health tech, med tech, and biotech services, which covers a big chunk of the general health and life science market. In those sectors, slightly different factors, but the big driver for all of them is data and AI. And I think if you look at health tech, so technology that's providing healthcare provision. So how do we deliver healthcare to patients? We've got a market which is, in many of the large Western markets, aging rapidly with more and more chronic diseases, which are becoming more and more expensive to manage. So how do you fix? It's not sustainable. So how do you fix that? And that's where the promise of data, AI, and technology can help ease the burden, can take costs out of the system, drive efficiencies. So there's a big unmet need there, and that's why this is a great time to be investing in that space. In the medtech, the medical device market, traditionally been engineering companies, not known for their strength in software development or data or AI. I think trying to get better at that. Many try to build it in-house, but ultimately many of them like to buy that in from companies that are doing it. So that's a great opportunity to build companies with really strong data-driven and AI-driven components to them. And the reason why that's important is, again, you're getting more of a drive from hospital to home. That's changing the dynamics of the hospital market, which represents a very large proportion of medtech revenues. So their whole market is shifting. So how does their business evolve to continue to grow into the new ways that healthcare is delivered?
Are these discussions you're having here at the forum exactly about that topics you just mentioned?
Yes, absolutely. And I think I think the people in this space are very aware of that subject. I think people who are seeing something's happening in healthcare don't quite understand the details, but grasp it very quickly.
What are the biggest takeaways so far from the forum or people you met here?
I think everybody, this is a forum that's not just about healthcare, but it's a very major subject that comes up across a number of areas. People are talking about, equality. People are talking about geopolitics. And very quickly after that, the word healthcare is often mentioned. So it's a very top component, I think, of many other aspects of what's going on here generally.
Thank you very much. I think it was a very, very good overview about what is going on in the market at the moment. Thanks for taking the time. and I wish you a very good end of the forum.
Thank you very much. It's been
Thank
a real
you.
pleasure.
Thank you.